education and it's about advocacy. Um, and the networking part of it is important because through this organization, I know virtually everybody that provides services to seniors in the Rochester area. And when somebody is referred to me for help, even if what I do is not what they need, I know where to send them. I've been on the board of this organization for 5 years. For the last year and a half, I've been the president of this organization. Um, I very recently joined the board of the Alzheimer's Association in our area. I'm a member of the National Placement and Referral Alliance. This is a professional organization of people who serve in the same capacity as I do. I am a certified dementia practitioner, which means that I've studied how to better interact, communicate with, and serve the needs of people who have dementia. And I'm a member of the Better Business Bureau. So all of these are just sort of my qualifications to do the kind of work that I do. So, I want to start with a basic concept, which is that nobody wants to move into senior living. Everybody wants to stay home. And I understand that, and I see it every day. And it's not a bad thing to want to stay home. Um, it's what my parents wanted. Both of my parents are gone now, and I served as a caregiver and a support system for them in their final days, and what they wanted to stay home. And sometimes that's the right thing, and it's possible, and sometimes it's no longer the right thing. The problem with staying home, there's a variety of them, but the biggest ones happen to be loneliness. So often when a senior stays home, they spend most of their time by themselves, and that's not a good thing for their health. Staying social is important. I can tell you that in my dad's last years, he only lived a few miles away from me, but several times a week, I would just jump in the car and go over to his house because I didn't know if he'd seen anybody all day. And I know that human interaction is important.
So Mike, this leads me to my first question.
Sure.
And that is, given that most seniors seem to want to stay home, when should a family start even looking at facilities or get some understanding of what the senior living options are in their area, especially when their loved one is saying, no way?
Great question, Mary. And the honest answer to that is way before you think you ever need it. And the reason for that is a number of things. I think it benefits a family to begin discussing these things with mom and dad way before they need it. And the idea should be, in case we ever want to consider this sort of thing, let's start to educate ourselves on what the options are. What do these things look like? Okay. And I think that by doing that, and by doing that, I'll tell you that I'm a senior myself now. I'm on Medicare. I'm headed rapidly towards my 68th birthday. And I think that it makes sense to begin looking into senior living options in your late 60s, early 70s, which for most people is way before you would need it. But let's start to find out about these things and start to gather information. I think in many cases, it'll take some of the fear out of it, because I can tell you for a lot of folks in their 80s and 90s, the idea is, oh gosh, I never want to go to one of these places because my memory is of what these places looked like for my parents when they were at the end of their life. Don't put me in a home, okay? Don't send me to those places because they were dark places and they were not great and they were sad places. And people need to understand that there are so many great senior living options right now that don't look anything like a nursing home.
That's so important because that really is how seniors seem to think about them if they have no knowledge of the current places.
Absolutely. In
Right.
deciding whether or not to stay home, I think that one of the things that you ought to keep in mind is how can I be my best self? How can I age well? If I want to remain independent and I want to continue living life to the best of my ability, what things are there that I can take control of that will make a difference? And here are the top things that you can do to keep yourself independent and healthy. And I can start with number one of them, and I can tell you I am not doing a good enough job of this right now myself. I had a knee replaced in October, and I know that getting out there and exercising every day is important for my health. It's important for my mindset, for my physical well-being, and I'm not doing it well enough. And oftentimes that happens with seniors. And I will tell you, I repeat this all the time to my clients. It's really all about use it or lose it. So getting out there and getting moving is something that you can take control of that will have a big factor in your ability to function independently. The other thing, or the next thing that they say is hugely important is we need to retain social connections. Staying connected to our family and our friends and our community and our church, those sorts of things keep us healthy. If we lose those connections and don't have regular connections in those areas, it has a negative impact on our health. Item number three comes into play all the time when people stay home too long. And that is, I can clearly remember seeing it in my father's case, which is I love to cook. Okay. But as my wife will tell you, I like to cook for big crowds and I like to make a mess and use every, pot and pan in the kitchen. And doing that for one person is no fun at all. And the result of that is many times seniors are starting to degrade physically because they're not eating properly. It's too much of a pain to shop and prepare meals and clean up afterwards. So they devolve to eating crackers and soup and cookies, and they're not eating a balanced meal. They're not eating healthily. And the result is it has an impact on their health. And, the next thing I think is more challenging for some people to picture, but really is important. And that is setting goals. I know that my wife is watching me putting off retirement right now because I can't imagine what am I going to do with myself? As I get out of bed every day, what goals have I set for myself? What am I going to accomplish today so I feel like I accomplished something? And, setting goals and achieving them are one of the factors that contribute to, staying healthy as you age. So all of these things are factors that you can be thinking of in order to keep you healthy. And if it's your goal to keep you at home, which, as I said, is what so many people want. But let's imagine that those things are going in the wrong direction, and I need to start to figure out what is senior living? What does it look like? What are the different options that are out there? And I'm going to take you through a basic conversation of what each of these different terms mean. And I'm going to start with 55 plus senior apartments. And I will tell you that this category is confusing because a lot of people will identify this as independent living. And I want to delve deeper into that so people understand what it means. So, senior apartments are a very popular category right now. They cannot build these things fast enough. When they build a new senior apartment, a complex anywhere in this area, it fills up immediately and there's a waiting list. So what does this mean? Well, it starts by meaning that they build a senior safe space. What does a senior safe space mean? It means there are no stairs you need to navigate. Okay. If there are is that there's more than one floor, there's elevators, and there shouldn't be any stairs that need to be navigated in these buildings. That's item number one. Item number two is the bathrooms are built in such a way so that you should be able to have wheelchair access if needed. There will be grab bars everywhere around the toilet and in the shower. And it should be a place where it's easier for a senior to live safely. I mean, that's a problem for so many people that decide to stay home. And I'll use myself as an example. Love, love, love the home that I live in. It's 100 years old, okay? And the bedrooms are upstairs. There is a bathroom downstairs, but there's no bedroom on the main floor. So, will this really be a place that I will realistically be able to stay when I'm in my 80s? And the answer is it's hard to tell. Maybe not. Okay. There's many different apartments that fall into this category. Some of them are subsidized, which means if your income falls into a certain bracket, then you qualify for them and they're lower in rent. Others, they look at your income, and if your income qualifies, you pay a percentage of your income as rent. Those are two types that absolutely, positively, there are not enough of. And as they build these things, they fill up really quickly. Now, where I'm going to differ in calling these independent living is these places offer little or no services. In other words, there might be gathering rooms for clubs or activities, but there's very little done in terms of activities, and they provide no other services as it relates to meals or transportation.
Can I
Okay?
just clarify one thing, Mike?
Sure.
Are these always apartments? Are they ever something that you purchase?
They are usually apartments. There are some places where there is a buy-in involved.
Okay,
Okay.
thank you.
So here's just a few examples of these sorts of apartments in Rochester. There are many, many more examples. Like I said, they just can't build these fast enough. So now I'm going to move to talk about independent living. And here's how I'm going to define independent living. Take that same 55 plus senior apartment. So no stairs, guardrails in the bathroom, okay? A senior safe space. And we're going to add to that some services. And these services can differ from one place to another, but usually they will include the following. There will be some sort of meal plan option. I'm in my 80s and maybe I'm not driving so often anymore. I don't like to drive and I don't want to shop. So there are meal plans available. It might be 3 meals a day. It might be X number of meals a month. It might be 2 meals a day. They'll be different in different places, but some amount of meal service is part of the package in independent living. They will also usually offer some level of transportation services. Most often, this will be we offer some opportunity to take you to doctor's appointments. Okay. It might be limited. It might be we do that on Monday, Wednesday, and Friday. We help you make the appointments, we'll schedule them. We might limit it to a certain area, but there's some amount of transportation services. Those transportation services will also usually include we go to the grocery store once a week. We go to the drugstore once a week. We go to Target twice a month, that sort of thing. And we usually utilize our transportation services also to take us on group outings. We're all going out to lunch once a week, and here's where we're going. Okay. There will usually be some level of housekeeping services. Okay. We're going to clean your apartment once a week. We're going to change your linens for you. Okay. We're going to empty your garbage on a daily basis. Okay. And they also usually have some level of activities, probably an activity director, probably a schedule of things that we're doing. There's exercises in the morning. There is a card club in the afternoon. There might be a happy hour twice a week in the evening. There's movies, there's trips, there's, some sort of activity plan. And that's what independent living looks like. And in the Rochester area, I'm going to back up here. Um, this is roughly, these places are going to start at about $2,000 a month. They're going to go up to and over $4,000 a month. They're going to start with studio apartments. There's going to be, one bedroom apartments, maybe larger one bedroom apartments, a handful only of two bedroom apartments. The cost is going to vary by how old the community is, how fancy the amenities are there, how big the apartment is. Usually, when you move into a place like this, there's going to be a one-time upfront community fee. This is a fee that you pay as you walk in the door that's usually roughly equivalent to whatever it costs to stay there for a month. There are some independent communities that will also require a much larger buy-in. And usually these are the communities that are attached to some form of CCRC, Continuous Care Retirement Community. In other words, we have an independent living community, we have an assisted living community, we have a nursing home, and if you buy into our plan, then we have a path for you to receive care from independent living all the way through a nursing home. That's a very basic explanation of those buy-ins. There's a lot of fine print associated with them. And if you get involved in a community like that, and there's many fine ones, you just want to make sure that you have a very clear understanding of what the buy-in looks like. Okay, so that's independent living. Any questions you want to answer there, Mary, or anybody else? You're on mute, Mary.
I'm sorry. No, I don't have a question about that, but I will have more for you.
Sure. Okay. So moving on, we're going to talk about here's a handful of independent living communities in the Rochester area, all of which I know very, very well. Probably a good place for me to say that as a function of the work that I do, I have been in every single senior living community in the Rochester area, every nursing home, every assisted living, every independent living. I would never ever think about connecting somebody with or recommending to them a community that I haven't been inside of myself.
What would you say the average age is of your clients who choose to go to independent living?
Well, the truth is, and this is a big problem industry-wide, these places were built initially with the thought process that active seniors in their 70s were going to live there. And the truth is, everybody is staying home too long. And the result is, even in independent living communities, when you walk into one of these places, everyone you see, for the most part, is in their 80s and their 90s.
Okay.
The people that I take to assisted living who are much younger than that are usually there because they have a significant amount of dementia or physically they're deteriorating very rapidly.
Great. Thank you.
So I want to provide a basic overview of assisted living. And assisted living is a complicated animal, but the place that I want to start in explaining to people what assisted living is assisted living is not healthcare. Again, I want to say assisted living is not healthcare. I'm going to build on the same conversation we've been having. It's a senior safe space. It's going to provide some services in relation to housekeeping, in relation to meal planning or meals, in relation to transportation, but it's also going to provide some assistance with activities of daily living. Okay? What does that mean? Well, in assisted living, all your meals are provided for you. Okay? All your meals are restaurant style. You'll go to the dining room and they'll say, we're having, um, spaghetti with meatballs for lunch today, or a chef salad. And you can say, I don't really want either of those things. And they will give you a list of other options. Okay, we can make you a cheeseburger. We can make you a soup and salad. All of your meals are provided for, 3 meals a day. Okay. They're going to do your laundry for you. They're going to do your housekeeping for you. Okay. They're going to manage your medications for you. They will make sure that you are taking every one of your medications when you're supposed to be taking it. They can help you with showering. I need assistance in the shower. Maybe I just need somebody to stand outside and make sure I'm safe and hand me the things that I need. Okay? I can mostly dress myself, but I have trouble putting my shoes on. They can help you with things like that, whether it's laying out your clothes, whether it's assisting you in getting dressed, getting ready for the day. They can help you with those sort of things. So again, that senior safe space, now we layer on meals, housekeeping, laundry, medication management, and assistance with activities of daily living. Okay, so that is what assisted living is. Mostly, assisted living is a room and not an apartment. Mostly, assisted living, they want you to think of the whole community as your home. There's lots of living rooms and activity areas and places to hang out. Your room is usually, a spot for your bed, a dresser, a nightstand, a closet, a private bathroom, room for a couple of chairs, your TV. That's what most assisted living rooms look like. Some will be larger, some will feel more like apartments. Sometimes they'll have a kitchenette, but remember, they're providing all your meals for you. So a full kitchen would be a rarity in assisted living, not found very often. And one of the examples of something that you'll pay more for. So I can see it looks like you got a couple questions there, Mary, so go ahead.
I do. Can you clarify the extent of personal care you can expect in every assisted living, or does it vary?
It absolutely
Depending
does
upon-
vary. So
Okay,
there are different levels of licensure for assisted living. Okay. What I've described so far is basic assisted living. Okay. They can help you get dressed, they can help you in the shower. Okay. That's basic assisted living. If you need more complex or more hands-on care, okay, that may not be covered in basic assisted living. Let me give you some examples of that. When you go to assisted living, there is going to be a form filled out by your doctor saying, yes, I believe this is the appropriate level of care for Mary. And here's her medical history, and here's her medication list, and here's the things she needs assistance with. At the same time, their director of nursing is going to do an interview with you and find out, what do you need help with and what can you do on your own? Okay. There are some areas of assisted living that are more complex, like I need help getting in and out of a chair, getting in and out of bed, getting on and off the toilet. moving from my room to the dining room. Okay. Those are things that can be done in some assisted living facilities if they have the right licensure for it, but is also something you can absolutely expect to have to pay more money for. Some of those things are covered under what's called an enhanced assisted living license. It also might include other medical things like I need oxygen and I need help managing my oxygen. Or I have a catheter and I need help managing my catheter. Okay. I have diabetes and I no longer can self inject for it. Okay. Those are some examples of things that possibly can be taken care of in an assisted living setting, but not by all assisted living communities, and should be something you will expect to pay more money for.
So family members need to be very clear on the needs of their loved one. And then how do they anticipate future care needs
Excellent
as they're
question.
looking at this?
And something that I deal with all the time. Okay. So let's forgive me, Mary. Let's imagine for a moment that I'm placing a much older version of Mary in assisted living. Okay. I'm going to want to know what she needs help with and what she doesn't need help with. But I think it would be a shame to place her in a community where, yes, they can meet her needs, but boy, if she gets at all worse, she's no longer in the right community. You know, if the financial resources exist to place her in a community where, as her needs grow, their ability to care for is still possible, that's where I would prefer to see her placed. Um, Oftentimes, we can't do that because the resources are so limited that we have to go to the least expensive option available, but then we're in danger of 6 months or a year later, or sometimes less than that, they're no longer able to meet your care needs. And understand that that's not something the assisted living community likes to see happen. But what they're allowed to do and what they're not allowed to do is governed by the State Department of Health, not by that assisted living community.
So this must be a regular problem for you when your client has, say, early dementia.
Mm-hmm.
You know, can that facility maintain them through the entire disease or any chronic illness that is very predictable in terms of how it's going to get worse?
So it's an awful problem. And the truth is, I want to clarify something that you just said there. When you're dealing with dementia or when you're dealing with Parkinson's, we know those are progressive diseases and we know they're going to get worse, but we don't know when they're going to get worse. We don't know what the arc of decline is going to look like. It's impossible to predict. So, what we're trying to do is usually put our loved one, our senior, into the best possible space for them for hopefully the next couple of years, because beyond that is impossible to predict. Okay. And really a challenge. And is also absolutely going to be impacted by the amount and type of resources we have available to deal with this problem. So, average monthly cost for assisted living in the Rochester area last year was about $4,800 a month. But that's just an average, and it can get significantly more expensive depending on how new, how fancy, the size of the apartment, the level of luxury, the type of care needs. So that figure is representative of basic assisted living and is only an average. So there can be less expensive, there can be more expensive. some examples of assisted living in the Rochester area. There are many more. There, in Rochester, we're blessed. There are many options for senior living. Not always the case in other places. So now I'm going to talk about memory care. Okay. And Mary brought this up. What about if we're placing somebody that has dementia? Do they need to be in memory care? Well, not always at the beginning stages of dementia, but it depends on where they are in terms of the arc of this dementia. So, dementia care or a memory care facility might be, a wing of an assisted living community. It might be a separate community that's 100% memory care. And how it's differentiated is by a couple of things. Number one, it's more expensive because you need more staffing, because it requires a higher level of staffing to make sure that each individual gets the amount of one-on-one care that is necessary. Okay. So there'll be a higher level of staffing. Each one of these individuals needs more queuing and redirection in order to get through their daily life. But also, memory care facility needs to be a secure facility. So what that means is it's a unit that has precautions to make sure that a memory care resident doesn't get out of the memory care area, because one of the definitions of memory care needs is, if I wandered outside, would I remember how to get back? Would I remember where I'm going? And the answer, once you reach a certain level of dementia, is no, you don't. Very typical of somebody who has dementia. I'm going to use the example of somebody living at home is they get out of bed in the middle of the night and they start wandering and they get outside the house because they're looking to find mom and dad. Their reality is distorted now, and we need a secure environment in order to keep them safe. Okay. In memory care, you're also going to have activities that are structured for somebody who has dementia, structured by staff that is specifically trained to care for people who have dementia. So a different environment tailored to the needs of the people that are there. Okay.
I have a question.
Sure.
What do you do when you have a couple? Let's say one member of the couple needs assisted living, but the other needs memory care or is very close to needing that level of care. What's available to a couple?
Really, really challenging situation. And here's the reason why. Most often, in the beginning stages of dementia, if I take a couple to an assisted living community, they will attempt to keep them together. Okay. And, if I'm still living in an apartment with my spouse, she might be able to help the staff keep my care needs manageable. Okay. But understand that dementia is a progressive disease. And at some point in time, I need to be in the memory care unit where the caregivers and the level of staffing is designed for somebody with dementia. So oftentimes what will happen is eventually their paths are going to separate. And, in many cases, I'll attempt to, have one spouse in assisted living and the other one's in memory care, but they're in the same building. So the spouse can go down and spend time with their spouse, eat with their spouse, spend hours of the day with their spouse, but also have the ability to go back outside into the area where there are people who don't have that high level of dementia and that gives them some form of relief as well. But no, it is not possible to always keep people together in this environment because eventually their care needs are going to separate, and that means their paths are going to separate. So, basic
Thank you.
explanation of memory care in the Rochester area. Um, Average cost $7,000 a month. Certainly, there are many communities that might be more or less than that. All going to be a factor of how new, how fancy, the amenities that are there, the location of it. But again, we're blessed. There are a number of very fine memory care communities in our area. And here's just a few examples of some of those. So now we're going to progress to skilled nursing. And I'm going to talk about some terms here that I want people to understand. When I say a skilled nursing facility, that's the same thing as a nursing home. And one of the things that I want people to understand is that a nursing home has two parts to it. Every nursing home in the Rochester area has two parts to it. And that is, I am here for a short period of time called rehab because I've recently had an injury, a hospital stay, something's happened to me traumatically, medically. I went to the hospital. I don't need to be in the hospital anymore, but I'm not well enough to go home. So I go to a nursing home for rehab. It's covered by my insurance for a short period of time, and then hopefully I'm going somewhere else. Maybe I'm going back home. Maybe I don't need to be in a nursing home any longer and I'm going to an assisted living facility. But the term can be confusing. A rehab is a section of a nursing home. All nursing homes have that section. I'm here for rehab. Short period of time, covered by my insurance, and then hopefully I'm going somewhere else. Or I'm here for long-term care. This is the level of facility I need to be in for the rest of my life. Okay? Let's talk about when do I need to be in a nursing home? Well, I have great medical needs, and that means there need to be nurses for me there all the time. Remember, assisted living is not medical care. There might be some nurses there, but they are very limited in terms of what they're allowed to do. Okay? A nursing home has many nurses who have very few limitations on what they're allowed to do. So the people that live in nursing homes are either have a very significant level of dementia or have very significant medical needs. Okay. There are many things that can be the tipping point between I can stay in assisted living and I need to be a nursing home, but I want to talk about two of them in particular. One of them is the ability to ambulate and transfer. Can I get in and out of bed by myself? Can I get in and out of a chair by myself? Can I get on and off the toilet by myself? Can I walk down the hall by myself? Those are things that you will see in assisted living, okay? People using walkers, even people needing help with those items. But when it takes more than one person to give me help with those items, now I'm probably needing a nursing home or I'm very close to needing a nursing home. And this has to do with level of staffing. If every time I get in and out of bed, get in and out of the chair, get on and off the toilet, or am moving down the hall, I need two staff members to help me. Can't do that in assisted living. Okay? That is a trigger that means I need a nursing home. I hardly ever get out of bed. Probably I need to be in a nursing home. When I get out of bed, I only go to my chair and that's it. Probably needing a nursing home. Okay. Again, there's fine points and gray areas to all of these, but what I'm talking about are the larger tipping points for needing that level of care. Another tipping point for that level of care is level of incontinence. Okay. Now, there are issues with incontinence in all levels of senior care. Okay. All kinds of seniors struggle with this issue. The question is, what is the level of incontinence? If I can, you know, if my incontinence can be managed by wearing Depends, if my incontinence can be managed by putting me on a toileting schedule, then I'm probably still perfectly appropriate for assisted living. But when I'm having accidents with bowel movements and I don't even know I've had that accident, okay? We're probably close to nursing home level of care. When every time I use the bathroom, I can't clean myself and someone else has to do it, that may be handled in assisted living, but that puts me right on the bubble of now I need a nursing home. And then there are many things medically which are more complex, which might need to be handled in a nursing home and can't be handled in assisted living. I'll give you one other easy tipping point between assisted living and a nursing home. In assisted living, they're not allowed to feed you. Okay? They can cut up your food, they can set up your food, they can encourage you to eat. But if you need to be fed by hand, you don't belong in assisted living any longer. Now you're needing a nursing home.
Mike, can you clarify, going back to the incontinence and memory care units in assisted living versus memory care in a nursing home?
Mhm.
Uh, Are, are they different in what they're willing to handle? Or are they essentially the same?
They're similar, okay? I would say they're different in terms of what they're able to handle. Certainly, I've placed many people in memory care, a memory care unit that is licensed to deliver enhanced services, okay, who have very significant incontinence problems, okay? But there's a point at which they have to tap out and say, this is more than we can handle. Okay.
Okay.
If somebody is regularly incontinent, never knows that they're going, that, you have to be aware that they need to be changed, change them, and then clean them. At some point in time, that's going to cause issues with that person's skin. Okay. Because you can't sit in soiled Depends for any length of time regularly and not start to have skin conditions. So
Mhm.
there's a tipping point, and it's a
Okay,
fine line.
okay,
Certainly,
yeah,
lots of people in memory care who are incontinent. It's all about level and degree. Okay.
okay. Mhm.
And,
Thank you.
you know, always, 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 there is dementia in nursing homes. The Sometimes there are specific units designed for dementia. Sometimes that has to do with it needs to be secure because we don't want someone to escape, elope, and get lost. Sometimes it has to do with how difficult it is to care for that person if they have behavioral issues or become aggressive. So, all of these are fine lines that need to be discussed thoroughly before an admission decision is made. Make sense?
Yes, thank you for clarifying all of that.
Yeah, sure. So, I'm going to finish my discussion on nursing homes by saying it is a terrible, terrible time to operate a nursing home in New York State for a variety of reasons. Number one, like every other business in the world right now, you cannot get enough help. Think about the work that's done in a nursing home. It's awful, it's dangerous. and it doesn't pay very much money. So getting good staff in there and asking them to do the job we're asking them to do and keeping them there and keeping them happy, impossible. Okay. So in an average nursing home, let's say that nursing home has 200 beds. They're probably only able to take 150 people right now because they can't get enough help to take care of 200 people. So that's problem number one. Problem number two is 75% of the people staying in a nursing home are having their bill paid for by Medicaid. Medicaid is a federal program that's managed by the state. And, to put it bluntly, Medicaid is welfare. It means we, the people, are now paying for the cost of that individual's care. And unfortunately, even though it costs a nursing home on average $350 a day to take care of somebody, the state is only reimbursing the nursing home to the tune of about $200. So nursing homes are losing their shirts on these patients, and the result is they're in a very difficult operating position. So finding and getting a nursing home bed and knowing the difference between the good, the bad, and the ugly in the nursing homes is very, very challenging. Um, you know, I've got at the bottom of this slide, average monthly cost of skilled nursing care in Rochester last year was $17,000 a month. $17,000 a month. Very few of us have the resources to be able to pay for that for any length of time. But the ticket to getting into a better quality nursing home is having the ability to privately pay for a year or more. So really, really challenging situation for many families. Here are some examples of nursing homes in the Rochester area. All of these examples are places that I've done a lot of work with and I consider to be good nursing homes. There's many more. But wow, that was a whole lot of information in a very short period of time. And we have some time left, so I'm happy to answer more questions about any of these areas.
I have one more.
Yeah, go ahead.
That money topic again. Now, I'm not sure we talked about assisted living how is that paid for?
So assisted living is based almost 100% on your ability to privately pay. So when I'm talking to families, and most often, I'm talking to a family where maybe one spouse has passed, the other one's been living at home. Now that's not going so well any longer. And we're talking about how much income comes in every month, how much money they have in various bank or retirement accounts, and the value of the house. Those are the things that are used to pay for assisted living. Now, if this person was a veteran, there's a possibility there are some benefits that could come into play. If this person has long-term care insurance, on the one hand, that's a very, very valuable tool that can be used to pay for this. On the other hand, it's very difficult to get your long-term care insurance started and get them to begin paying for it. So also a complicated landscape. But none of these things are covered by your Medicare. All of them are based on your ability to privately pay.
And in assisted living, are any of them paid for by Medicaid? Are there any assisted living facilities that will take Medicaid?
So the answer to that is yes, but, okay. Very, very limited selection. Without wanting to be unfair to those communities, not the highest quality of care, and some very stringent specifications about what it takes to get in and what they're allowed to do. And just for example, remember, Medicaid is welfare. When Medicaid is paying the cost of your assisted living, it means we're putting you into a room with somebody else. So you're sharing a room, and that room, I want you to picture as a college dorm room from the 1970s. Okay. It's a small little room. And yes, they will meet the care needs of that individual, but it's not fancy, that's for sure.
All right, thank you. Any other questions from people? I've got the chat here, but I'm not seeing anything. You certainly covered a lot.
So
Thank you.
I'll go on to answer one other question that was on your list, Mary. When should people begin thinking about senior housing? Well, let's get into that early and educate ourselves before we end up in a crisis situation. Most of the work that I do, so I help people navigate these solutions, and almost all my business comes to me by virtue of professional referrals. My doctor's office sent me, my elder law attorney, the social worker at the hospital, the discharge planner at the rehab center. And um, almost all of that is crisis work. Something bad happened. We can't go home again. Our insurance is cutting us off at the end of the week, and we need to figure out where we're going to go. So I would say start doing your homework early, educate yourselves, and in a plug for myself and the other people who do what I do, there are local professionals who do this all day every day, and they can guide you through this process much more quickly, much more easily, and often at no cost to you. I've got a network of 67 communities in this area where I can work with a family, help them select the one that meets their needs. The family never pays me anything because the community is going to pay me. So seek out professionals who are knowledgeable in this area and start asking questions before you get to a crisis situation. If you suspect that yourself or a loved one or your parents is perhaps a fit for this type of care, I'm telling you they are a fit for this type of care. So let's get involved and get involved early.
That's a great point. I also liked your point that it's much less threatening for the older adult to start talking about this well before they have to think about doing it. Yeah.
At the risk of making fun of a client, I have a 95-year-old woman that I have been taking on some tours, and she asked me today to take her on a couple of other tours because she's not quite ready yet. And at 95, I would suggest that maybe you are ready and it's time to pull the trigger. So let's get out there and get ourselves educated.
All right. Well, you got a thank you from one of our listeners. So thank you.
Okay, excellent. Well,
Really
my
appreciate
pleasure.
it, Mike. All right. Thanks
All
so
right, guys.
much.
Have a great day.
Take care.